I think anytime I get a new drug, I'm really concerned as to whether it's going to have some kind of an adverse reaction with perhaps something else that I'm taking. So for my husband, I always need, he has like maybe 14 different kinds of pills for all of his different things. And with him, I'm concerned whether he's getting all of the pills on exactly when they're supposed to be taken.
So for me, I'm not a pill person. I'm terrible. I'm not so much medicine. I do la'au lapa'au. I do Hawaiian medicine, and I think a lot of it is my intake is how. So I'm always concerned about medication, the long-term effects. I'm concerned about, for instance, I try to get off the metformin, and somehow or other it's like my sugar got so high that I got afraid that then, okay, I better go back on. So to me, it's such a dependency. It becomes such a dependency.
For me is to understand what medicines I'm taking, why I'm taking it, how often I have to take it, and make sure that I have it. So I have pill boxes that's like for a week, and I try to make sure that, I make sure that it's all filled, and I take my medicine. So taking my medicines is no problem. Just making sure that when I'm almost out, I put an order in. What I get frustrated is when I to put my order in, I don't have refills, so that means I gotta call the doctor's office, and then I call the doctor's office, and then it takes a few days, and then you gotta give them the whole list, like, you got my chart, just pull my chart out and order it. No, they're asking, okay, what medications you need, okay, how many times you take it, what is the, I'm like, well, okay, that's a good test for me, but so I try to make a printout of my medication, or what I get from the drugstore, I keep it on hand, so when they're asking me, I pull it out real quick and I go, okay, yeah, my allopurinol, yeah, 35 ml, yeah, okay, and I take it once a day, so that I can repeat it to them and stuff. So
I'm a pharmacist. I mean, it's just whenever I get a new prescription or I have any questions, I always go in and just talk to the pharmacist and see and if they can't answer the questions, then I'll go back maybe to the doctor. But our pharmacists here are good. We have the complete list of everything that I'm taking or everything that my husband is taking. And if something new comes on the market, it's like, or comes up that I have to get a new prescription, it's always wait for the pharmacist and talk to the pharmacist, and he'll answer any questions or make sure that you understand, so it's just there and it's provided. So you take advantage of that. They make it a smooth transition for you to just be able to say, can I talk to a pharmacist about something? And
I trust my pharmacist. Yeah, I not necessarily trust pharmaceuticals, or my physician's prescription, but I trust people who take the time to give me, you may have this reaction. This is why your doctor prescribed this according to this prescription. Yeah. Everything is a rush.
just go to the drugstore and go, is Kelly working today? They go, yeah, can I please see her? Okay, Auntie, she'll be right out. Kelly, my husband having a hard time, with his bowel movements or something. She goes, okay, well, does he have this medicine? I go, he does. So she educates me on the medicine, because how often he should be taking it, and because he gets his medicine from the VA, so he doesn't really order from them, but they have the same kind of medicine. So I said, I don't understand, what is this medicine for? So she says, okay, and how often can he take it? Because it doesn't really say, how often he can take them or what. And then the doctor tells him, but I don't remember sometimes. So she goes, no, you can take them, you know, like once, or you can even take them 2 capfuls, you know. So I always ask Kelly when I get concerns, well, Kelly, you guys get anything for dementia? He asking me for ask you guys. She goes, Marianne, there's really no, you can just take gummies and have him chew them and say, yeah, that's for dementia.
Both my husband and I are concerned about is our lapses of memory. And so Prevagen is always that one that's out there. It's like, oh yeah, take Prevagen, but oh my goodness, do you know how expensive Prevagen is? And does it work? And does it work for everybody? Or is there a stage that you shouldn't be taking it? I mean, there's a lot of questions, but a lot of it is, for me, is around the memory thing. And how do I know that you are now beyond a Prevagen? You know, because again, seeking out a doctor's help here on island it's doable, but if there's something that I would have confidence in that pharmacists or pharmaceutical companies are doing that's not necessarily over the counter, but something that's a little bit a step above, even something that could be partially cared with your insurance, that would be my desire.
The long-term impacts or effects. How does it address the cause of your problem and not necessarily various symptoms? We drop a pill because we're gonna calm the effects of the symptoms, but we're not addressing what I should get rid of and how I should change my lifestyle so that I can get off.
My husband's big beef, and I don't know why, and I figured it's because of the insurance, is that why does the doctor give you a month's supply of medication? And they go, okay, let's try this. And then you take them for, this is my husband, and you take them for like 2 weeks. The thing don't work. Then you go back to the doctor. Okay, well, let's try this. That's another 1 month supply. I get all these other bottles that I had before this medicine. Why they not can just give you like, okay, let's try it for 2 weeks. Here you go, and see how the medicine works. And I said, well, I don't know. And I said, maybe it's an insurance thing that they gotta give you a month's supply, or maybe that's how long the medicine going to take to kick in. Why the medicine gotta take that long? Then why am I taking it if it's not gonna kick in until 1 month? So that's his argument. And then if it doesn't work, then you gotta go back to the doctor, and then they give you another medication that you gotta try again. So your system gotta try this medicine and try to get rid of the other medicine, And so yeah, he's kind of like that kind of person that thinks about that, And so that's why he gave up on pharmaceuticals. Yeah.
I had 1 year of cancer, and for whatever reason, going through a year of chemo and having a lot of things, I never asked for pain pills. And I actually had one of the pharmacists recognize that I hadn't asked for pain pills, and the pharmacist remarked to me, Auntie, it's not shameful to ask for pain pills if you need it. If you need to have something for pain, you can talk to your doctor and get it. And I was really touched by that, because I thought, this person really cares. This person really is aware of who I am, what I'm going through, my needs. the answer to her was, I so appreciate it, but for some reason God just has not put a lot of pain with this, and so I'm okay. I can manage that pain level with just a Tylenol, once or twice a day. But that's when I knew that people were really aware, and it wasn't just a person behind the counter.
But the person who, I don't know if she's a nurse practitioner or a dietitian but she could prescribe, and she also, check my, what do you call that? Yeah, she could check my whole thing and with her monitor, and okay, I see where so she dealt with my health challenges, which is diabetes, so I'm trying to find another person like that. I think there's just a target and focus on you, the patient, and for me, my diabetes.
Well, I just had an appointment with my lung doctor on Thursday, and so he and it was supposed to be personal, face to face, but he didn't come out, so I did a telemed with him, and then he came on and he goes, "Hi, Marianne." I said, "Hi, Doc." He said, "Hey, you're looking really good." And I said, "Well, thank you, Doc." And so he said, "How much weight have you lost now?" And I said, "Well, I'm down to 180 pounds." And he said, "Wow, that's really good." He said, "When you first started," he said, "How?" I go, "Doc, I was 40 pounds. And so now I'm down to 180. I mean, it's taken me 4 years because it's ever since I started dialysis." He goes, "But look how much you did." He goes, "Okay, wait." And I guess he's a number doctor or whatever. He goes, "Let me try to figure out, see what's the percentage." And then he came back. He said, "Wow." He said, "Wow, I can't believe it." He said, "You lost 25%. And I went like, "Oh, thank you." He goes, "No, really, I am so amazed." He goes like, "What got you to do?" I said, "Well, Doc, since I've been at dialysis, I watch other patients. I see them come in. I see them come in either grumpy, or I see them come in just quiet, or like the ones that are grumpy is like they're mad at the world." I said, "But why be mad at the world? Because you're the one that put you in this chair. Nobody else did, because you didn't take care of your health. Now you have a choice to be in this chair and be better, and so look forward of being even better." He said, "I am so proud of you." He said, "Very good."